Do a sound check. Jill Ludford, Chief Executive of the Murrumbidgee Local Health District. Okay, good morning everybody. Welcome to the COVID update for this Monday. And it's, I guess, an exciting day for New South Wales, where once again we've seen further easing of restrictions as a number of fully vaccinated people continues to climb. So I thought I'd start this morning with talking about how we're tracking in terms of vaccination, then how we're tracking in terms of the impact of the opening and easing of restrictions across our region, and then we'll go down to the case numbers. But I think it's really important to preface that as we start to see people from Victoria and Sydney and everybody driving around, and we start to prepare for Christmas, that our communities should expect to see some small numbers of COVID cases in their regions. And I think we're still very used to the messaging around elimination, where whenever there's a new case, we try and track every movement in every venue. But now we're actually into living with COVID, and it's all about how we can add layers of protection to keep ourselves safe and to lessen the transmission in our communities. So in terms of Murrumbidgee, we're currently sitting at 97% single dose. So that is extraordinary, wow. We may even get to the 100, and 88.9% of our community across our region fully vaccinated, which is an outstanding result. What's really important though is our vulnerable populations, and one of the high levels of case numbers we see are in children at the current moment. So the 12 to 15-year-olds, 80.2% of our children have had their first jab, which is fantastic. Parents, thank you. And we've inched up now to 58.3% of those children fully vaccinated. And what we've seen in the outbreaks, and particularly the lessons learned in Albury, is about 2/3 of the caseloads are in those under 19-year-old age group. It's very difficult for little children to, obviously schools are doing a brilliant job keeping people segregated, but it's less easy to control all of those social distancing rules that are so important for us. So in Albury, we're partnering with schools there around doing some rapid at-home antigen testing, and the principals in Albury have been absolutely fantastic in terms of handing out the kits and providing parents with information about how to do that. It's an important week for schools with the higher school certificate starting, and we want to make sure that we can support schools to provide a really safe school environment. So children doing that rapid antigen test twice a week provides parents with just that level of assurance that it's okay to send your children to school. And we'll start to see the reduction in numbers of transmissions that are happening in schools. How we're supporting schools is over the next 2 weeks, we're running a testing clinic in Albury, where if people do get a RAT positive test, which is a rapid antigen test that's positive, it doesn't mean their child has COVID, it just means they need to come in and have that proper PCR swab, and we'll send that off as a priority and get results back to parents and schools as quickly as we possibly can. So I think that's really important around how we can again put those layers of protection around our communities and our vulnerable level of communities as best we can. So in terms of hospitalisation, we currently have 3 people hospitalised in Wagga at the present time, and we've seen very low rates of hospitalisation as we've seen more and more cases across our region. We've got over 300 active cases at the moment, but majority of people are being cared for in the community in the home. We've got 28 in the community in the home across the region, and in the Albury community in the home, of which we're looking after New South Wales residents, we have 116. The treatments for managing COVID in non-vaccinated people are becoming more and more successful, and we've seen in recent days information from the Australian government now about an oral medication which can help to lessen the impact and severity of COVID should people contract it if they're unvaccinated. So what we're really talking about today is how we are learning to live with COVID as we move forward. But we are still living at a time where we are having outbreaks, and we have reported 25 new cases overnight. 20 of those are in the Albury local government area, 2 here in Wagga Wagga, 1 in Griffith, 1 in Edward River, and 1 in Federation. So we're sadly also reporting 2 deaths. Both of the residents are from aged care facilities, a woman in her 80s and one in her 90s. One was fully vaccinated and the other had received just one dose of the COVID vaccine. And the work that we are doing with Albury Wodonga Health in supporting aged care facilities has been very much around ensuring staff are rapid antigen tested and ensuring that GPs are coming in and completing vaccination and booster doses for aged care residents. And our heartfelt condolences to families, to carers and to friends of those sad deaths. So just finally, I just wanted to talk a little bit, I guess, about as we're starting to see outbreaks, and we saw one recently in Wagga Wagga here with a particular venue, and just to reiterate that if there is a venue of concern, that New South Wales Health will publish that. So we saw that recently with the Inspired Church, and people who were there who were at particular risk due to the time that they spent indoors will be sent messages by New South Wales Health advising them if they're a casual contact or if they're a close contact, and with further information about what to do. And the Service New South Wales Act continues just to give general information to people around venues where COVID cases have been, but all it means for people who have been to those venues is that they just need to really monitor for symptoms. They do not need to have a COVID test unless they contract symptoms. And testing rates are good across the region. We did over 15,900 tests in all of the testing facilities across the Murrumbidgee region in the last 7 days. So happy to take questions.
Jill, as you'd be aware, there's been a significant outbreak of COVID at Ivanhoe. Given Ivanhoe's proximity to Hay, is there any concerns, or what's the dialogue been between the Far West and the Murrumbidgee health districts in regards to managing that going forward?
Yeah, it's part of the general conversation, I think, about living with COVID as we start to see outbreaks happening in different local government areas. And again, where we have vulnerable population groups, that is very important for us to be able to look at how we can make sure that we can get those vaccination rates as high as we can in the vulnerable population group. Unfortunately, through the Hay have a fantastic Aboriginal corporation who have a health service there and are doing some great work in terms of vaccination. We work really closely with our neighbouring local health districts in terms of monitoring movements and sharing information, public health information, to make sure that we can really limit the amount of transmission that comes and seeds across from different outbreaks.
Is there any specific message for the community of Hay, given that Ivanhoe is probably the closest big community, and there may be a bit of travel, or there has been travel between those communities in recent days and weeks?
So the message is much like we gave to the people who lived in the greater Hume and Albury region. If you live close to an area where there is a local outbreak, it is really best for you to really just limit your movements for a short period of time. Obviously, we're not talking about lockdown, but we're just saying if there are things like outdoor birthday parties and extracurricular activities, particularly involving children or the elderly, that we should really just restrict those things and monitor and watch really closely for symptoms. The other places to monitor during outbreaks is workplaces. So we know that tea rooms and events where people might be sharing a birthday at work are particularly high risk. So my message to people living in Hay is, just for a short period of time, it's a good idea for you to just restrict your activities that are extraordinary. Make sure that you hold anything outside and really ensure that you have all your layers of protection. Very important to wear masks when there is a local outbreak in the region as well, because masks do add that extra layer of protection for people. And if you haven't had your final jab or your first jab, now's the time to come forward, and there's lots and lots of venues in Hay, pharmacy, and also the Aboriginal Health Service.
Jill, you kind of touched on it there with Hay, but in terms of us having 25 new cases today, is there any further advice for people here? Should we be following those same sort of precautions in areas that are, well vaccinated?
I think our general message to people is it's really important that we can learn to live with COVID, and it's hard for our communities who have had a very, very strong message previously for the last 20 months about staying at home and really limiting your activities. Now we've seen today the government again further ease restrictions and reduce some of those capacity limits that were previously in place. So my message to people is go out, go about your business. It's important for our mental health and well-being that we do get back to being with family, being with friends. It's really, really important. But always remember, COVID's still with us. It hasn't gone away. So remember to wear your mask and also remember to always check in. We are starting to see a number of outbreaks, a number of venues where people haven't necessarily all checked in. So if I could please remind people, use your QR code and check in, or if you don't have a smartphone, then just make sure you do that manually.
I understand in recent weeks we've had cases where they've been attributed to a certain local government area, but later it's been determined that they're actually isolating outside of that local government area. How do you go about managing that information and not, feeding into the rumour mill when these things happen and dealing, with the ramifications of, cases being attributed to an LGA, but the infectious people not actually being there?
And look, communities who have not previously had a case can get very, very concerned and worried about having COVID in their community, and I fully appreciate that. The way that it works is that the public health cases are reported by postcode, and as we know, and we've seen this with vaccination rates as well, is postcodes sometimes go across to local government areas, and it sometimes gets attributed to either or and not quite into the right place. So locally we know, particularly where there are villages and other things around, where that should go, and we always try to have it corrected as best as possible. And again, how it works is if somebody is away from their home address and they contact COVID, it gets attributed to their home address. And so not all the cases are necessarily in the community. My general message is pretty similar to the other messages. COVID is going to be all around us, and we need to move away from monitoring case by case and venue by venue, and more really pivoting towards ensuring that we protect ourselves through vaccination and all the things we've discussed, and getting back to some semblance of normal again.
I know you mentioned, I think it was 3 patients are at Wagga Base Hospital on the COVID ward. There's 4 cases, I think, that are in hospital at the moment. Where's that final case? Where are they?
So there is a child who is probably an additional case that was included in the numbers, so 3 adults, yes. So that would be a social admission.
Yeah. Just in terms of boosters, Jill, I know we mentioned last week that obviously healthcare workers in our region are already coming forward for those. Have you had other members of the community coming forward, or what's your message if you have had a slow uptake of people coming forward for boosters?
Boosters are really important, and I think for people to get their head around yet another message, we're a little bit at saturation at the moment with COVID messaging, but boosters are going to be really important, and there's a lot of evidence to show that a booster really does give us a very high level of protection against COVID-19. So anybody now is eligible who have had their second dose in the 6 months ago can now come forward, and as of today, those boosters, which are all Pfizer, are also available in pharmacies. So we want to get those layers and layers of protection up. Having a booster is the ultimate. So I know a lot of healthcare workers have already started to have their boosters because they were the first, along with police and emergency services, to be vaccinated. So I encourage all of our population now to come forward. If you've had your second COVID vaccine in the last 6 months, now you can book in and come forward and have your booster dose, either at your GP, pharmacy, or in any of our clinics.
But has that had a good uptake so far? I know it's hard to say figures, but...
Yes, and look, across New South Wales there's already been 17,000 done since last week. So yes, we have had a really good response with our boosters, but the majority of people who are coming forward at the moment are healthcare workers and also emergency services workers, because they were the first to be vaccinated. The other really important priority group that we vaccinate are people who are aged over 65 and living in residential aged care facilities. We are very, very focused now on working together with our primary health network and our GPs and encouraging those GPs to get their residents done in aged care facilities. it's all about the vulnerable groups.
Just touching on that, given that we are hearing in a number of cases where an older person has passed away from COVID, that they've either not been vaccinated or only had one vaccination, given that the elderly were, top priority when the vaccination rollout first started, what does that say, I guess, about the success of that campaign? Has it worked, or has the message just simply not got through to that particular age group?
I think some of the challenges in residential aged care facilities are when we have new residents who have come in and moved their home into that particular facility, and then it's about ensuring now that we check that vaccination status of people who come into new residential aged care facilities, and if they're partially vaccinated, making sure their general practitioner completes that vaccination regime.
You touched on the rapid antigen testing that's occurring at Albury schools as well, and how you're working with the education department on that. Is that RAT or RAT testing likely to be rolled out across the wider health district at any stage in the future, or is Albury the focus for now?
So at the moment we've started, it is a public health measure, and Dr. Kerry Chant was down in Albury and listening and talking with parents at the schools and principals, and really wanted to have a look and see how it would work in terms of being a surveillance measure to give parents that extra level of, I guess, reassurance that it's okay. Continuous learning for children going forward has to be one of our state's top priorities. They have had a very disrupted 18 months of in and out of at-home schooling, and it's really critical that we can provide that really safe environment. So at this point, we're just seeing and getting the feedback from parents about how it is, what it's like, but there was a really great uptake of the kits. We heard today at our meeting that the principals were very supportive. There was great uptake, particularly in the high schools, and so far we haven't had any positive RAT tests. But I really don't want parents to panic. If they do get a positive RAT test, they do need to come forward and have that swab. But really reducing the number of times that schools are becoming non-operational while the principals undertake the cleaning and identifying close contacts and contacting people who've been on buses. If we can reduce that chaos, then it's got to be a benefit. So we'll see how it goes.
Speaking of Albury, are you concerned about low testing numbers in that region at the minute?
I think last week we did see a reduction in testing numbers, but the old Melbourne Cup might have a bit of impact on that. So always we see reduced testing, interestingly enough, on weekends, and adding a public holiday into the mix, I think, saw those numbers reduce down. I think the other reason why we saw testing numbers reduce in Albury and Wodonga was because the schools became really very proficient at doing their messaging to parents, and so we had the right people coming forward for testing rather than everybody who was concerned coming forward for testing when they were non-symptomatic.
But the advice, I suppose, is still coming forward for testing and to utilise both on both sides of the border if need be as well?
Absolutely, and I was very fortunate to be invited to the new drive-through testing clinic that's opened up in Wodonga, and it has great surge capacity, which will be able to surge up and down as we get, peaks in testing. But the way that we can manage outbreaks is very much around getting people in for testing if they have even the slightest hint of a symptom, and into isolation to reduce that community transmission.
What did the numbers in Albury today tell us about the outbreak there? And are the people testing positive mostly household contacts, or is there still that community transmission going on?
So it's we've got case numbers that are sitting somewhere between 15 and 20 a day, and some of it is, I guess, predicated on the number of tests that we do. So when we have high testing, we tend to have high case numbers. But each day we're getting more and more numbers, then we've always got more cases under investigation. And there is still community transmission in Albury, particularly in the under 19s who don't necessarily, or who are very active in the community. And, we really need to make sure that we get people doing their QR code check-ins so that we can absolutely track and trace everybody.
What do you anticipate will happen in the Albury-Wodonga area shopping and things like that?
Look, as we move forward with COVID-19, we can expect case numbers, we can expect small outbreaks, but the higher our levels of protection, then I guess we're going to really reduce the impact of transmission and also the impact on the health system. Albury, Wodonga have had a terrible time during COVID-19 living on a border. They've had to live with different orders, different restrictions, border closures, but they are one community. But they are getting, obviously, visitors from Victoria and Melbourne, and they're also getting visitors from New South Wales and regional New South Wales because it's a beautiful area to go fishing and to relax in. So they are more vulnerable, but they are a very resilient community and they have great resources there to be able to manage it going forward.
That Albury border region, do health authorities think that we've reached the peak of cases there, or could we see those go further up?
Look, it's too early to say, really, particularly where we've got transmission happening in schools and with younger people. And we live, obviously, for a future year where we have a vaccination in children, which will really reduce the transmission that we see in communities. So we will just continue to encourage people to come forward for testing. And the numbers really have stopped escalating, but they're sitting fairly stable as we continue to get on top of the cases through tracing and testing.
And just the last one for me from Albury. In terms of the outbreak at Mercy Place and Southern Cross Care, we know we had another 2 deaths at Mercy this morning. Any update on how that facility is tracking?
So residential aged care facilities have a lot of work to do with their residents if there is either a staff member test positive or a resident test positive. They come together with both Australian government officials, their local health provider, in this case Albury Wodonga Health, as well as their own organisational requirements for their COVID safety. The most critical thing in a residential aged care facility is the vaccination of the residents, the vaccination of staff, which is now mandatory by the Commonwealth Government, and also their infection prevention and control management plans, and really cohorting and isolating any residents who become infected with COVID-19 and providing them with the very best clinical care in their facility. And at Albury Wodonga Health have done a fantastic job with geriatricians, infectious diseases doctors, and a range of nursing support staff who have looked after the residents during their illnesses. And it's really important to note they have not had a new case for 7 days now in those residential aged care facilities, and some of the facilities are starting to transition out of the isolation period. So no cases in the last week is good news.
There's been some confusion in the community just in terms of locations where COVID cases have been. Not too sure if they're venues of concern, as some would say. Just what is happening with those locations in terms of deep cleaning?
So the way that the New South Wales Government is now working with businesses is that there's very detailed instructions for businesses about how to manage if they've had a COVID case in their business. If they have had a COVID case in a staff member, they're required to report that to Safe Work New South Wales, who will help them manage that particular situation, and businesses are required also to notify other staff. If it is a patron or a visitor to their business, then if there is any concerns at all about that venue, they'll be contacted with New South Wales Health. Otherwise, there's really great information on the New South Wales Government website about what they need to do in terms of cleaning their facility or their premises or their business.
So just changed rules so some places may not have to deep clean anymore?
There is cleaning instructions up there. And all businesses who've had a COVID case should continue to clean, and we can call it a deep clean, yes, each time they have a COVID case.
Yep. And so speaking of exposure sites, I think in Albury there's currently 2 listed by New South Wales Health. Has the department stopped publicising those low-risk exposures, or have infectious people just sort of stopped going out to venues?
So the New South Wales Public Health Units will publicise venues where they are concerned there is a risk to the population, and where they are still working to try and contact close and casual contacts, because they may not necessarily have a full list of people who have been there. So only the venues where we have concern are publicised, and they go up on the website as soon as the public health contact tracer has done the interview, so that we can get that information out to the general public as soon as possible. What we've seen though is lower risk venues, for example supermarkets and petrol stations, where there is very low risk of transmission. Those are venues that are no longer listed unless there's been a particular risk in that particular place.
In the press release today, it said that there were 116 people being treated under the care in the home model by Western Sydney Hospital. Just wondering what that meant.
So we are assisting Albury-Wodonga Health in looking after some of the lower risk COVID patients who are not necessarily all that sick. And so 116 of those patients, because it's what we call a virtual model. So a clinician rings up the person every day and sees how they are, checks their symptoms, see if they need anything, particularly around isolation support in terms of food or medication, and to really monitor their symptoms and escalate to the medical fraternity if they require further care. So those numbers were going up a lot in the Albury-Wodonga region. So currently Western Sydney are assisting us with looking after some of our patients.
Sewage detections in Albury, Wagga, Young and Griffith, I take it the message continues to be if you exhibit symptoms to go and get tested in those communities?
Yeah, and the Wagga sewerage would be expected obviously because we've got COVID patients in the hospital here. But what we've seen over the last few weeks, is we've seen positive samples in a whole range of places, Leeton, West Wyalong, Young and around the place, as I guess we're seeing people moving around more. But for those communities, if you have positive sewage detection in your town, just monitor really closely for symptoms.
I have one question from Griffith.
Yeah.
What's the status of the 5 people with COVID there, and have they been isolating since their diagnosis?
So all of our COVID positive patients from across the region are carefully monitored to ensure that they're undertaking their mandatory isolation. We do work closely with New South Wales Police, who also assist us in monitoring and looking after people at home with COVID-19. We haven't had any breaches of particular issues in that region. Thank you. Thanks, guys. Interesting. See how we go over the next week.